All right, I want to show you another fun case, so let's get into it. All right, this is another open bite case, but it has a little bit more of an added layer where she had very small lateral incisors and was going to be eventually getting some restorations done. So we did a little bit of interim bonding that I think is kind of fun in a case like this. So here's Susan. She came in, she was 33. She just had a lot of concerns. I mean, basically, she just never liked her smile. She didn't like the way that it looked. People thought she was missing teeth. She couldn't bite correctly, just a lot of things. And she had gone to quite a few different consultations along her span of the 33 years. It just never really did anything. Nothing really ever sounded good to her. So she saw us and we kind of made a very straightforward approach that built on layers of, really great braces and building up teeth as we needed to, using our lift procedure to take care of the skeletal problems. And it just made sense to her. So she started treatment. If we look at this, we can see that she is fairly complicated, right? We have a vertical problem in the posterior. She's got a little bit of an open bite, a class 2-ish on the right, midline deviation, some functional shift issues. And then again, those laterals on the upper are quite small with a micro crown form. And, we just basically wanted to make sure that we treated these in a stepwise fashion. So again, you can see a little arch constriction as well. Smile arc is poor. Just everything in this case can help her. We need maxillary arch development, some space for the laterals, maybe some gingival procedures, temporary buildups, and then additionally, we need bite closure because we need to make sure that we take care of the vertical component in this case. From the x-ray, again, it just substantiates what we're talking about, posterior contact only, and again, a little bit of an open bite. So you can see that in a span of a short time, we were able to take care of all our concerns. And really, I just want to break down how we did this. It really only took about 13 months. So again, we break everything into phases. So her first phase is basically the foundation phase. We're going to go ahead and we use Damon Ultima in this case. But the main idea was creating space, arch development, lateral buildup, laser, and then the lift procedure to take care of the vertical. So again, we start with bracket positioning. Again, nothing outrageous. It's very traditional bracket positioning since we're using a full expression system. We want to make sure that we set these dominoes up for her. So the first thing we need to do is to create some space and really get this anterior starting to develop a little bit. So about a few months into treatment, we were able to get some space for the laterals and get things lined up. She knew that we were going to have probably 2 separate rounds of buildups because I wanted to get some composite on these small teeth so that I didn't bring them too far labial. And in other words, because the teeth are tiny, the in-out is going to be off on these teeth. So what I wanted to do was to just get the braces on so that I could get the space lined up. I use a little laser, trim them, build up a little bit prematurely on the facial so that I get the bracket back on. And then I can start setting the buccal lingual dimension of these teeth. So pretty much right when we got the space, used a little laser, trimmed the laterals, built them up temporarily, and then put the brackets back on. You can see here that at the same time we did that, we used our lift procedure. Again, in the last few cases, I've highlighted this, but in case this is the one that you're looking at, I just want to briefly describe this. Our lift procedure is our vertical load-induced force technique to intruding molars. So if we look at this, the first step is pretty simple. We drive 2 8mm tads between the second and the first molar, right at the mucogingival line. The second step is to put 2 8mm tads about halfway down the alveolar ridge on the palatal between the second and the first molar. We're going to go ahead and bond buttons on the palatal because we're using the braces on the buccal of these teeth. And then the last step is just to activate these with 1 link of generation 2 power chain, which gives us about 60 grams of intrusive force, giving us a very ideal 30 grams per tooth. This is going to allow us to intrude these teeth. You can see from the buccal, it's just below the mucogingival line, and from the palatal, it's right about halfway down mid-root. And then we're using a little bit of C-chain to activate these tads. Now, the great thing is that we get some pretty good tad activation right off the bat. So you're going to get about 1 millimeter in the first month. Again, for every millimeter of vertical change you get in the posterior, you get about 2.5 to 3 millimeters of bite closure. So here she was the day that we placed the tads and built up those teeth. You can see that things are looking good. We have the tads on the palate, and you can see the tads a little bit on the buccal, but they're between the 6 and the 7. And we've got those activated with C-chain. But this is 4 months. So just, a couple months later, you can see that we're really starting to close. We've created some more space on that upper left lateral, and we're in a position where we can now bring these wires out and put in our phase 2 wires. So again, in 6 short months, we've really got this case, kind of the foundation set, the plan's moving, and we're now moving to this phase 2, which is optimization and expression. So the timeline shows an 014, an 018, tad buildup, gingivals, upper twos, little laser treatment. And then at that point, because we wanted smile arc, we now are starting 334 triangles, and we're retying the vector tads. And then we have 140275 copper nighties in. So if we move on to phase 2, this is where we're going to put on our 180275 nightie. And if you've seen my presentations before, this is where we're going to express the wire completely. So we should be getting, a really nice look coming out of phase 2. So here's 3 months later. You can see now that we are still tying our tads. We're still closing the bite. We've got our full expression wires in, and even have a little bit more buildup that we've added to that upper left lateral, because I want to make sure that I get the size right. It's pretty easy. I mean, all we have to do is remove the wire, add a little composite. Our patients know that at the end of treatment, they're going to go to their general dentist, and the general dentist is going to go ahead and replace this with whatever restoration they decide upon. But I really want to make sure that the spaces are ideal and it's looking good through treatment. I just find it very difficult to manage these laterals if they're a small crown form, and I'm basically trying to keep space mesial distal, and I'm trying to position that tooth properly for future buildup. It just always brings the tooth too far facial, because if the tooth is small, unless you put an inset or lateral inset in the wire, it's going to bring the tooth a little too far labially. So again, end of phase 2 looks great, 3 months. We're really moving along. So you can see 180275 copper nightie. At that repositioning appointment is when I added the distal portion of composite to that upper left lateral. And now we're basically moving on to phase 3. So phase 3 is aesthetics, case completion, and exit strategy. Okay, so when we look at this, this is the phase 2 records. Here we are about a week before debond. Again, you can see everything's looking good. We've got the gingival architecture looking pretty nice. The occlusion's great. Her smile's filled in. Obviously the general dentist has some work to do on those laterals, because, I just do things to a very nice level, but, to a level that I want the general dentist to get in there. And you can see the upper right lateral, I did a little bit better job. That upper left, we have, some work to do. And again, she's planning on getting crowns on those teeth. So we can't wait to see what those look like. So now we're setting her up for debond, making sure that everything is good. And you can see here, we take out the tads, we build up the upper twos at the debond just to make sure things look nice before the retainers. And you can see here's where we end up. So this is the day after debond. Again, we sent a nice little letter to the referral saying we just did some temporary buildups. This patient's probably going to need maybe some gingival, maybe some crown lengthening, and then also, make sure that we get these restored sooner than later. And when they do, send the patient back, and we'll go ahead and put a new retainer on. So again, this is just a major transformation for this young lady, because, she never really smiled before. She didn't show her teeth. She had small teeth. Her bite wasn't working. There were just these layers. But like I say before, everything in a vertical case compounds itself. So the first thing you do is you get over eruption of the molars, and then you get an open bite, then you get your tongue position, then you have constriction. I mean, there's all of these things that occur. And, rather than fixing the 15 problems that are symptoms of the vertical, it's best to fix the vertical, and then those problems are easily resolved. Again, before and after, super happy, 13 months. You can see that we were able to treat the open bite, the class 2, the smile arc, and pretty much make this young lady really, really happy as far as her aesthetics go. So you can see again, before and after. Sometimes patients look and they say, it doesn't even feel like this was me. I never realized I had this in me. And when you hear things like that, you kind of know you're doing the right thing. And again, the dentist is going to rebuild those up and make sure they look great. But our job is complete, and now she can get over to, her dentist, and she can get on with her life. Again, not that much more complicated, other than the fact that I took a little extra time and added some build-up material along the way. Again, I do not want to have a patient leaving my practice with big gaps behind the distal laterals, only to find out that they don't get to the dentist. And then maybe they lose space and the dentist starts to get upset. And next thing you know, we're back in braces. And believe me, that's happened to me. And that's why I do these buildups. And I even tell the orthodontists that work with me, I know that you don't probably feel you're good at it, but it's better than nothing, and it's temporary. And I think that's what's really nice about it. So again, final patient records. Patient looks pretty nice. X-rays look good. Her before and after macro aesthetics, I think, are life-changing for her. And then her mini aesthetics really show the detailed work of what we're able to do with her smile arc. And again, micro aesthetics. Again, I do think she's going to need a crown lengthening procedure on the upper right lateral and maybe the upper left. But once these crowns get done, this case is going to be just quite amazing. So in summary, Susan was treated in just over 12 months, knocking out pretty much all the concerns. And again, the most difficult concern was the vertical component, but that was easily treated with the lift procedure, 4 TADs, 10 minutes, retie those when she comes in for 3 or 4 visits, and really we're able to treat this beautifully. So if it's something that you like, definitely please check us out, share this case. If there's something of value that you can have somebody help learn, we only grow in this community by learning and sharing knowledge. So check out our socials and just keep in touch. We're going to keep posting more stuff like this. Thanks a lot. Bye-bye.